mission of the urology section at Virginia Mason is to provide state-of-the-art compassionate care for our patients and to advance the field of urology through excellent education and research. And I really think that really fits the true spirit of this whole entire group. The team approach is really paramount to our mission.
I think when you treat the patient today, you have to treat the whole patient, not just with surgery, but from many different angles. I think really looking at a multidisciplinary clinic is key to modern day medicine. Bringing in the pathologist if there's tissues that have to be reviewed, bringing in a medical oncologist to look at things from a chemotherapy standpoint, bringing in a radiation oncologist with certain diseases, bringing in a nutritionist, bringing in a social worker.
You know, we get many patients from the entire Pacific Northwest and across the country, and it's a necessity for them to be able to come here and have their full evaluation and their definitive treatment where possible, all in one visit. I think Virginia Mason is very nimble. It's an organization that really has everything very tightly organized such that we can deliver efficient and quality care for our patients.
So this is multi-channel video urodynamics, where we're taking images of the person as their bladder fills and as it empties. And here we're testing the pressure at which she leaks. Research at Virginia Mason Medical Center is both innovative and promising because we have a comprehensive research program in the pelvic floor. We have long-term surgical outcome data. In addition, we're performing translational research, which is bench to bedside research in urinary incontinence prevention, novel treatments for incontinence that are utilizing a better understanding of why incontinence occurs, as well as trying to enhance our surgical materials to make them safer and more effective for patients.
So I had a look at your notes, and when you put it, we're fortunate in that patients like to come back to Virginia Mason for their follow-up care, so we get a good opportunity to follow them for a long period of time. We've done that in prostate cancer, and that's helped us identify what we think of as important contributors to their outcome. So we've managed to use that long-term data and patients' tissues to generate long-term outcomes in prostate cancer, which is very, very important.
13, left mid posterior.
13, left mid posterior.
From the clinical standpoint, we have close to 3,000 patient database, which are our own patients. So we can actually look at the results of our treatments that we're doing and tell our patients who are coming for future treatments what our results are. So we can give our own numbers on that.
Virginia Mason is actually based on urology. So this institution was founded by a urologist. We historically have had a very strong fellowship program and now have an emerging residency program. We're able to help teach the next generation of urologists, essentially to live in the footsteps of giants in the field who've helped establish the urology program at Virginia Mason. The robotic system, in terms of teaching residents, is an integral part of our education process. So we have a dual system, a dual console system, which is very much like learning how to drive a car, where your instructor has a brake and your instructor has a accelerator. And so with that dual console system, we're able to maintain patient safety. We're able to ensure that patients have the best possible outcomes. On the same line, we're able to ensure that our residents, that our fellows leave our program with all the information, with all the techniques that they need to perform the surgery on their own once they've graduated the program.
I think what gives me one of the biggest joy in my everyday work here at Virginia Mason is seeing someone who comes in with a very complex issue. They've seen many physicians before. They really come here as the ultimate choice. They feel like they're desperate. There's nothing else that could be done for them. And being able to offer them options and offer them help to be able to get better.
The greatest joy in what I do is really centered in patients' happiness and their outcomes.
I think Virginia Mason Urology is about its people. The providers are at the top of their field and care passionately about their subject. They've dedicated their lives to treating these patients, and I think they do so with such empathy and such respect, and I think that means the world.
It's a huge privilege to try to carry on the legacy of Virginia Mason Urology. Dr. Tate Mason, Dr. Bob Gibbons, Dr. Roy Correa, who are all urologists and huge leaders within the field of urology. In that tradition, this section has continued to be a very strong force in research and leadership in the field of urology, both nationally and internationally.